All right, so welcome back. So this is part two. So in part two, now we're going to look at some different surface features of some of the bones, and this will be this part here will be helpful when we get to the latter part of the lecture, in which we're looking at specific bones and we're looking at specific markings on those bones. All right. So the first class of markings are going to be depressions. All right. So we're going to look at depressions, we're going to look at openings, and then we're going to look at some actual um, uh, projections, some actual points on bones. All right. So first looking at depressions. So depressions in general are going to be somewhere where there's a kind of an increase in the depth of the bone. So the bone kind of goes down into itself a little bit. All right. So we'll see these where certain bones meet each other. We'll see them where there's a blood vessel or a nerve that runs by. There's various reasons for these depressions. So one of them is known as a facet. Right. A facet is a smooth, flat surface that allows one bone to meet up with another bone. Right. So think of your ribs. So your ribs connect posteriorly to your vertebrae. There is a costal facet on your um, on your vertebrae that match up with an articular facet on your rib. And so these two facets join together, they're very flat and they're bound together with connective tissue, and this joins these two bones together, right? You also have one's called a fossa, right? Or fossae if you're talking about more than one. These are larger depressions in which you can have um, a bone join with another one. Okay, so you can have a region on the humerus known as the olecranon fossa. You have another one called the coronoid fossa. You have a fossa in your temporal bone called the mandibular fossa for the mandible. But these are all shallow depressions in which one bone can sit kind of in that groove or in that fossa to join the bone to form an articulation. You also have one called a fovea. All right, so a fovea is another kind of similar structure, a shallow depression, and there's one specifically on our femur called the fovea capitis, where there's a small ligament called the ligament of the head of the femur that attaches there and then keeps the hip in its socket. In our hip. And then we have a groove. So a groove is a kind of long and narrow depression. And in this instance, for the rib, it's called a costal groove. So the term costal just means rib. Now, for the costal groove, this is actually a very significant one clinically. So in this groove, you have what's called the intercostal vein, right? And the vein stands for a vein, an artery, and a nerve. And this costal groove with this intercostal vein, the vein, artery, and nerve, sit at the inferior aspect of the rib. All right. So there's a procedure in a clinical setting known as when you insert a chest tube. So chest tube insertion. The chest tube goes in between the ribs, but when you insert it just above a rib. All right. For the reason that if you put it just beneath the rib, you run the risk of the needle puncturing and damaging one of those vessels or one of those structures. So either the intercostal vein, artery, or nerve that runs in this costal groove. So instead of sticking it on the underside of the rib where you could damage one of those, you stick it on the superior aspect of the rib. All right. So the second ones are openings. All right. So openings being somewhere in the bone that has an opening in it. There's a hole in it. All right. And we have different types. One is called a canal, or also known as a meatus. This is like your ear canal, right? So if you stick your finger into your ear, you are sticking it into what's called the external acoustic or external auditory meatus. Usually if there's an exterior something, there's also an external something, there's also an internal, and there is an internal acoustic meatus as well, right? We have a fissure. So we have something called a superior and an inferior orbital fissure that allows the passage of arteries and uh, veins and nerves that are making their way from the brain inside the cranial cavity into the orbit, so into the area where we have our eye. And then we have a foramen. So a foramen is just a hole. It's an opening in a bone, right? So we have foramen associated with our skull, so what are called supraorbital foramen above the orbit, above the eye. We have ones below it called infraorbital foramen. We have ones in our chin called mental foramen for the mental region. You have ones in your cervical vertebrae called um, transverse foramen. You have a large one at the base of your skull called the foramen magnum, or the large hole. So you have these openings all over. And all of these are transmitting some type of blood vessel or some type of nerve through it. Okay, so they're not just there just because, but they're there to allow the passage of something. All right, and then we have projections, and projections are a very broad class of bony features or bony surface landmarks. Okay, but the good thing about projections is you can actually feel many of them through the skin. All right, so we'll talk about a few of them as they come up. So one is called a condyle. A condyle is a projection that has a smooth, rounded surface. All right. So we have condyles of the femur. So femoral condyles. You also have condyles of the mandible, in which they're called mandibular condyles, or a condylar process of the mandible. You also have a crest. A crest is kind of this large, sweeping edge of bone. If you put your hands on your hips, what you're feeling off to the side, kind of on the lateral side of you, is you're feeling your iliac crest. That's this large, flattened region of bone that you have on your hip. We also have heads. A head is just one end of a bone. It's rounded, but it's typically larger than that of a condyle. And usually the head of a bone articulates in a socket of another one. So a good example of this is the head of the humerus associated with the scapula, so to form our shoulder joint, and then the head of the femur forming our hip joint, right? And both of those are ball and socket joints. You also have ones called tubercles and tuberosities. These are projections that are rough, all right? And the roughness of this tubercle or tuberosity allows for the attachment of a tendon from a muscle that attaches there and then can move the bone. So where your deltoid attaches to your humerus, there is one called a deltoid tuberosity that serves for the attachment of the deltoid muscle. You also have ones called epicondyles. So an epicondyle is referring to a region above a condyle or lateral to it. And so a good example of this is one called the medial epicondyle. You can feel the medial epicondyle very, very easily. Right. So if you stick your arm out and you stick your arm out straight with your palm up, and you feel on the medial aspect of your elbow, you should feel around kind of where your funny bone is, you should feel a very large bony projection. If you move your fingers just posterior to that and you push hard, you'll get this nice shooting sensation, tingling sensation run down your hand, run down your arm into your hand and fingers. That's the ulnar nerve. That's your funny bone. And you find it by finding this medial epicondyle, so this bony landmark, and going just posterior to it. Okay. All right. The next one is a process, and a process is typically a kind of narrow and pointed end of a bone. All right. So we have lots of processes. We have ones called styloid processes, um, olecranon process, coracoid process, mandibular process. There are lots of different ones, but there's some type of point to a bone, all right, a slender, sharp projection. And then you have a spine. A spine is kind of a flattened ridge of bone, and the good example of this is on the posterior aspect of the scapula. We have the spine of the scapula, all right. Okay, and then the last three here are protuberances, trochanters, and lines. So protuberance is a small kind of bump of a bone, and a good example of this is if you feel on the posterior aspect of your skull, you should feel like if you find where your ears are and you go just posterior and maybe a little bit superior, you should feel this little bump. This is called the external occipital protuberance, and this serves as the attachment site for a ligament called the nuchal ligament that's associated with our neck and our cervical vertebrae. We also have one called a trochanter. A trochanter is just a really large projection. Okay, so it's similar to a if we go back here, similar kind of to a tubercle or a tuberosity, but it's just really large, right? And we have trochanters on the femur. So we have the greater and lesser trochanters of the femur that serve as attachment sites for muscles, all right? And then we have a line, and a line is just a very long, very subtle, but elongated ridge. So it is a raised region of bone. And again, it's going to serve as an attachment site for a muscle by way of a tendon, right? So all of these projections that we've talked about, protuberances and trochanters and epicondyles and processes and tuberosities, all of them, they're all serving as an attachment site for something. Okay, typically a muscle by way of a tendon. All right, so we're going to stop here with part 2, and we'll pick up in part 3 by talking about marrow cells, getting into red bone marrow, yellow bone marrow, and then we'll talk about specific types of bone cells.